Hello everybody, greetings and salutations, Noob Dad here with Real Talk number 5. So, in this Real Talk we're going to talk about something that is taboo but really shouldn't be, and that is sex in pregnancy. Okay, and intimacy as well. Now, the reason why I made this video, or chose to make this video, is purely because there were questions that I had in our pregnancy, in Hannah's pregnancy, that I asked because I have no shame, but I know that some men would probably shy away from, to be honest, and some birth partners would shy away from. So I thought I'd put this video together just to kind of answer a few questions that I've researched. Now, my research comes from a few places, such as obstetric doctors, also midwives, and also nurses as well, that I do know personally, that we've talked to when Hannah was pregnant before. So they do come from medical sources, and also as well, I may stick a few links in the comments below as well, just to show you where you can look these things up. Now, it is perfectly normal to want to have sex, even during your pregnancy, because at the end of the day you did it to get pregnant, right? So like I said to you before, here's a few kind of questions and myths and stuff, and a few facts that you need to know about it. So first of all, is it safe? It is perfectly safe, but as with everything in life, there are a few exceptions to the rule. So in this particular case, what exceptions are there to the rule in this case? So, for example, when your waters are broken, okay, that increases the risk of infection for both mother and baby, so don't do it. And also as well, babies coming, who wants to do it then anyway? So that's that, number one. Number two, in the case of a low-lying placenta. Now, in the case of a low-lying placenta, it is fairly dangerous to do it, although some people have claimed that they have done it. Just don't, because at the end of the day it's putting unnecessary risk on both you and the child. What it can cause is it can cause bleeding as well, which is unpleasant, but also is quite dangerous, especially when you're pregnant. Now, another complication that you may have is something called a subchorionic hemorrhage, or subchorionic hematoma, which is basically a collection of blood or blood clotting that's on the outer fetal membrane or within the walls of the placenta itself. Now, usually in most cases this isn't really a bad thing, it'll just be reabsorbed into the body because it is blood after all, or the clot may be absorbed, but in some cases, if it doesn't shrink, it does grow and it pulls the uterus away from, it pulls the placenta away from the uterine wall, which is not a good thing at all. So if you do have those, or you think if you're having any kind of blood during sex in pregnancy, please go get it checked out. Go to your local A&E department or go and speak to your midwife, because it could be something a bit, it could be something that could save both yours and your baby's life, or could negate the complication in your pregnancy as well. But also, like I said, just go get it checked out, just for your own peace of mind. You can sometimes get bleeding in pregnancy, but you can get something called an irritable cervix, which is what Hannah had as well, so just be a bit careful with that, okay? Now, here's a couple of things as well. Here's another question that's often asked, or something, or statement that you just get said: I don't want to have sex because I think it'll hurt the baby. No, it won't. Women's bodies are beautifully designed to actually lower the risk of the baby being hurt. They're very well cushioned because of the abdomen and the layers of fat and also flesh between them and the outside world. They're in that amniotic sac, so they're in a fluid-filled bubble, which dampens all the knocks as well. Plus also as well, the baby ain't going to have any clue what's going on. All they're going to know is it's going to be the same sensation as mother taking a walk, doing the hoovering, dancing about, whatever they choose to do. All they're going to feel is vibration, and they may move a little bit. That's about it really. Or even if the woman comes to orgasm, they may get contractions, but I'll come on to that later in this talk. but above all, it's actually good for the baby. It's good for your partner, and it's good for you in a number of ways. So, for example, what's going to be now the reason why it's good and great for you all is because it's going to help with a number of things. It's going to help because of the hormones released during intercourse with a pregnant woman. They're going to get things like your dopamine. Now, your dopamine is going to be released by both of you. It's basically the reward hormone and the feel-good hormone. So you might have heard of thrill seekers. They have a lot of dopamine swimming around in the blood. They get addicted to the thrill. Same way you can get addicted to sex through dopamine. It's a feel-good hormone. It's a rewarding hormone. That's what it does. You get endorphins and serotonin, which is life's happy pill. There's also serotonin is released by eating chocolate as well. So you might have often heard of people saying, oh, they might be craving some sex because they're eating a lot of chocolate recently. There's maybe a little grain of truth to that. I don't know, it varies from person to person. But yeah, endorphins and serotonin, it helps lift depression. It's the same as taking a small dose of antidepressant if you do have regular sex every day as well, which is great. Which is great. Also, I'll back one moment. Yeah, so as I was saying, it does release your serotonin and endorphins, which helps lift depression. Also feel-good hormone as well. Oxytocin is released as well, so that's the cuddle hormone. So that helps for the bonding between mother and baby. Also helps between the bonding between you and your partner as well. Helps everybody come together with the cuddle hormone, which is fantastic. So yeah, it can bring you closer as well in pregnancy. Which leads me to our next question: what position is best? An answer to this one is do whatever makes you two feel comfortable and helps you get the most out of sex. Simple as that. Just be aware that ladies' bodies do change during pregnancy, so what you may have been able to do before, you may not be able to do after. Or during the pregnancy, should I say. What you can do in the first trimester isn't necessarily what you can do in the last trimester. Just have to be a bit careful with it. Also be aware as well that later on you may get contractions. Nothing to worry about, usually Braxton Hicks. Just lay down, just relax a bit and they'll usually go. It's a great time for experimentation. You may find that you find a new favourite position. You never know. So yeah. Now, also, what happens when, say, the lady doesn't want sex, or you feel then you feel disconnected from your partner and things like that? To be honest, there's no excuse for feeling disconnected from your partner at all. They may not want sex, but this is where intimacy comes in. There are other ways of being intimate without having full penetrative sex. You don't have to do that. You could try, at the end of the day, you could try mutual touching. You could try non-sexual touching, such as massage, foot rubs, just cuddling each other, just normally cuddling each other a bit more helps that bonding as well. Walking hand in hand, that kind of can help as well. Just make the excuse to just touch each other and let each other know that you're there and you're thinking of each other. Have empathy. At the end of the day, they may say, oh, I'm feeling sick, or I'm tired, but yeah, think about it, they're growing a whole new human being inside of them, so yeah, they're gonna feel tired and they're gonna feel ill at times. Just be there for them, take time to love them, go out on dates, go for walks, because walks can help fresh air again, get your serotonin going as well. If it's sunny, great. If it's not, just go out for a walk anyway, that's cool. You could make a nice meal for them. I don't know, run them a bath with some bubbles, do something that they like, something help them to feel a bit more wanting and a bit more human. Also as well, if budget will allow, why not try going on a baby room? especially if it's your first child. That's one thing that I regret not doing with Hannah, because she was so ill during her pregnancy. Like doing some sort of baby moon where we go away somewhere. It doesn't have to be abroad, it can be in this country, it can be just a weekend away, something just to show each other that you appreciate each other, especially to your partner who's carrying your baby, because they're doing you a massive favour. They're giving you the greatest gift that anybody can give, which is a child. So yeah, there's plenty to think about there, and you just, all I can say is do what comes naturally. At the end of the day, if you want sex, have it. If you don't, don't. But always kind of consider each other's needs, be with each other, and bring yourself closer together. I mean, the baby should bring you closer together. At the end of the day, it's going to be a lot harder to maintain this close relationship after the baby comes than before the baby comes, or even yeah, well, I lost my train of thought there, but anyway, yeah, it's going to be a lot harder to maintain relationships. It's going to be hard. You're going to need a babysitter, whereas you don't now. So yeah, so that's my kind of 2 penneth on sex and intimacy and pregnancy. If you liked it, give a subscribe and a like. Everything's appreciated and it helps my channel grow a bit. There's 2 questions for today, just 2. Number 1, how would you show your partner you care? How would you be intimate with them without being sexual, or even being sexual if you really wanted to? And number 2, what other topics would you like me to cover that you might not necessarily want to ask people, or you feel shy asking people? Like I said, nothing's off limits on Real Talk. You can ask me about anything and I pretty much will go there on anything. So as ever, I've been Noob Dad, and I shall see you in the next video. Bye bye for now. Hello everybody, greetings and salutations, Noob Dad here, with another Real Talk. This time it is on a subject which men often overlook, which is what to put in your lady's hospital bag. We all know the essentials that you're supposed to put in for your ladies, so toiletries, change clothes, clothes for the baby of course, because you don't want them coming home naked or in a potato sack. That would just be cruel. Anyway, so we know we've got